Today we'll be talking about coding and clinical documentation improvement and how those are evolving in post-acute care. So why is CDI essential now? So when we look at why we're listening to this today, we know that there are increased requirements for quality data metrics. So everyone is looking for metrics and being able to measure and have measurable outcomes. So as the Centers for Medicare and Medicaid Services and the accountable care organizations continue to require more quality data metrics, post-acute care agencies need to establish a CDI program. And those formalized CDI efforts will result in sustainable success. So we really talk about some of those benefits that we could present to leadership when establishing a CDI program. It does include those improved patient outcomes, the documentation quality that will also support survey readiness, and then appropriate reimbursement based on supporting documentation in the EHR. So CDI isn't necessarily looking at trying to increase reimbursement for those organizations in a prospective payment system environment, but they're looking for that quality, and then that would be a secondary outcome of it. And then CDI is an integral part of information governance now, because we, in the medical records area, there's a wealth of information within the record, and being able to take that information and really dice it down so that you can analyze it and establish metrics from it really helps with the information governance. So the potential financial impact with the CDI programs, like I said, that's a secondary outcome. I mean, certainly we want to always be paid appropriately for our services. But what happens with the financial impact of the CDI program is that we should have decreased ADIs, or additional developmental requests, and denials, because we have proper documentation, or we could call it accurate or quality. Whatever term you want to use, it is better documentation. Another potential outcome would be decreased days to sending out physician orders. So for those of you that mail out your physician orders, or we have interim orders, or we have to have the plan of care signed by the physician, we'll have clear documentation of those diagnoses. And then decreased days to billing, again, because we're getting the doctor's orders back in a more timely fashion. And then that query education, so when we are sending out queries to physicians and our clinicians, that results in less questions at a later time so that they have a better understanding, they'll learn from it, and then documentation will improve sooner. And then we should have, again, better documentation, or quality documentation allows us to forecast. And so we can really look at our lengths of stay and any of our rehospitalizations, because that's a data point certainly that we're all looking at, so that we are not sending patients back to the hospitals within a 30-day period. And so that helps us with, again, that forecasting.